Hello, welcome to our session highlighting key data to support COVID-19 vaccination during pregnancy. My name is Hitomi Abe, and I'm a program analyst at NACCHO, the National Association of County and City Health Officials. My colleague, Senior Program Analyst Adele Lapia, and I will be presenting this session today. Here's our agenda for today's session. We will begin by providing an overview of NACCHO and our project, review COVID-19 timeline of events, discuss about the pandemic and its impact on pregnant and postpartum people, highlight key data from our findings, and wrap up the session with next steps and closing. For those of you who may not be familiar, NACCHO is a nonprofit serving nearly 3,000 local health departments across the United States. We serve as a voice for and with local health departments, and we conduct a gamut of work to support local health officials and their staff create healthy and thriving communities. Over to the right, you will see a list of the many ways we support local health departments, including advocacy, partnerships, funding, training and education, networking, and providing resources, tools, and technical assistance. We like to describe local health departments as chief health strategists. Local health departments are in unique positions to really understand the nuances that are unique to the different communities they serve. They serve as being on the front lines and are members of their community. Local health departments work with a variety of partners in their communities, including healthcare partners, government agencies, and community-based partners in a variety of ways, such as sharing information, regularly scheduling meetings, establishing written agreements, and sharing personnel and resources. Before I pass it over to Adele to discuss about this project, I would like to mention that this session development is part of the Emergency Preparedness and Response for Maternal and Infant Health Partnership Project, which is funded by Centers for Disease Control and Prevention, Division of Reproductive Health. Now I will pass it over to Adele to provide an overview of the project and share key findings. Adele?
Thank you so much, Hitomi. So I'll kick us off with a little bit of a background. Data has shown that COVID-19 infection puts pregnant people at an increased risk of severe complications and even death. A recent study published by the CDC found that pregnant people infected by COVID-19 were at an increased risk of stillbirth in the US compared to pregnant people without COVID-19, with a stronger association during the period of Delta variant predominance. Although stillbirth was a rare outcome overall, these findings highlight the importance of COVID-19 prevention strategies, including vaccination before and during pregnancy. Yet, according to the CDC, only about 35% of pregnant individuals have received one or more doses of the COVID-19 vaccine. In addition, significant disparities exist in vaccination coverage by race and ethnicity, with vaccination coverage being the lowest, about 21%, for non-Hispanic Black pregnant people. If you would like to reference the information we're sharing here, I believe it will be included in the slides attached. Next slide. So I just want to go over the project really quickly. With funding support from CDC's Division of Reproductive Health, NACCHO recently collaborated with the What to Expect When Expecting project to survey pregnant people on their likelihood of receiving the COVID-19 vaccine. What to Expect is a nonprofit organization dedicated to educating and empowering moms in need in the US and around the world so that they can expect healthier pregnancies, safer deliveries, healthier babies, and healthier futures. Next slide. So I want to walk through our methodology with you. This survey is a convenience sample. It was a brief 7-minute needs assessment using the Qualtrics platform. Conducted from July 27, 2021 to August 3rd, 2021. We received 1,141 complete responses. Data was collected via links on whattoexpect.com channels, such as mobile app feeds and online communities. And data includes pregnant and postpartum people. Folks in the survey sample were US residents between 18 and 45 years old, currently pregnant people, and people with at least one infant under 12 months old. Next slide. So to provide a little bit more context, we wanted to put this slide up for you to digest, and I will take a moment for you all to review the slides. This slide shows the monumental moments during the pandemic relevant to pregnant people, postpartum people, and infants and children. Within the slide, you will see when our needs assessment was administered. So our first needs assessment for what to expect consumers was actually administered in March, right before April 5th, when ACOG published a study around vaccine safe and effectiveness for pregnant and breastfeeding people, and when the vaccine became available for all adults on April 19th. You'll also see on the timeline there where the second needs assessment was administered in July. That's the one we're going to focus on today. And it was administered right before the COVID-19 vaccine was recommended for pregnant individuals as well. So before, pregnant folks were part of the vulnerable population that were eligible. On July 30th, it was recommended. And then our third needs assessment was administered in August, and we are not focusing on that today. So we're focused on the one in the middle. Next slide, please. So I want to go through a little bit of data before we get into the presentation. So our combined race definition field. Non-white was defined as Asian or Pacific Islander, Black or African American, Native American or Alaskan Native, multiracial, those that identify as other, and those that identify their race is white and ethnicity as Hispanic and or Latina. White was defined as those that identify their race as white and their ethnicity is not Hispanic or Latina. Next slide, please. So we wanted to give some definitions around what we classify as pandemic pregnancy. So covered postpartum was defined as those within a 0 to 11 months old at the time of the survey. Currently pregnant was defined as those who reported being currently pregnant at the time of the survey. And this is regardless of whether it was before May 2021 or not, because I believe that that's around the time in which the vaccination was recommended for pregnant folks. There were 11 participants that were both currently pregnant and currently in the postpartum phase. These participants were placed in the currently postpartum category. Next slide. So we're just going to go through our survey results here with you. So when did you receive the COVID-19 vaccine? Only 1 in every 3 pregnant people surveyed received their vaccination during pregnancy. Respondents living in rural areas were less likely to be vaccinated than those living in suburban and urban areas. So we'll get into that a little bit here, but I just wanted to showcase on the slide, again, that 1 in every 3 pregnant people surveyed received their vaccination during pregnancy. So you will see that a majority of the sample was not vaccinated. And again, putting it into context that this was administered right before that recommendation came about, but all along since the vaccine was available, pregnant folks were advised to consult their primary care physicians and OBGYNs around the vaccination. Next slide, please. So we wanted to know how important were the following decisions in making the decision whether or not to receive the COVID-19 vaccine. So while pregnant respondents were more than twice as likely to strongly disagree that the COVID-19 vaccine is the best method for protecting themselves and their babies, more non-white respondents were likely to report possible side effects to vaccinations as a priority concern to receiving the vaccine. So that identifies a little bit of vaccine hesitancy there, as we see that non-white folks at 68% versus white folks at 61% were more likely to identify possible harmful side effects of the vaccine on their unborn baby. And again, this is their concern. So that was the concern they had about it. And actually, if we look at the slide a little bit more, we'll see that throughout, except for getting the vaccine has made me feel safer, and getting the vaccine has enabled me to see my friends and family. We see that consistently up until those 2 points, more non-white people showed stronger concerns for each of these. Next slide, please. So this slide looks at what are your primary sources for trusted information regarding the COVID-19 vaccine. When asked about this question, respondents indicated receiving information from experts, including doctors, federal agencies, and public health officials. On the contrary, unvaccinated people were more likely to receive information from people within their social circles and trusted community members, including friends, family, religious leaders, and social media in general. Next slide, please. So given all that we've discussed today, we wanted to share a couple of recommendations for our local health department memberships. You know, our local health departments play a pivotal role in addressing vaccination hesitancy among families in their communities. And given the findings, we strongly encourage local health officials to continue to enhance communication and messaging around the safety and efficacy of the COVID-19 vaccine for pregnant people. We encourage LHDs to promote vaccination to all people, especially pregnant people, in addition to co-administration of the COVID-19 vaccine with the flu vaccine and other vaccines as appropriate. We also really want to guide people to use CDC's COVID-19 vaccines while pregnant or breastfeeding guidance, and ACOG's COVID-19 pregnancy and breastfeeding guidance as well. And lastly, we really encourage folks to continue to follow NATO resources to receive updates on federal guidance and messaging for promoting the vaccine. Next slide. So thank you all for listening in today. I believe our contact information is displayed on the slide. Please feel free to reach out should you have any questions. Thank you.